So we do have a few that can't read, you're right, and so we need to be ready to kind of go through that with them. So we'll be able to work with those. Very good. Excellent. Good job. We'll be ready to go. Part of the Office of Health Equity and Disparities is to really start thinking about what are some of the key needs in our community, particularly health disparities, where we find that some populations, particularly African Americans, Latinos, and other disenfranchised groups, tend to have worse outcomes compared to their white counterparts or those who may be wealthier, etc. So what we really wanted to focus on is, one, how do we ensure that people have the right information that they need to be able to act upon? And that's the education component. The other part is outreach. How do we as an institution partner with our community organizations to be able to ensure that we are doing the appropriate outreach? And third, we can educate, we can outreach, but if we don't ensure that people have access to the services that they need to be able to ensure that they have access to cancer screenings and treatment and survivorship, then all we've really done is educated and provided outreach. And so those three pieces are really critical toward addressing health disparities, and we believe it's a collaborative effort with our partners.
It's the Health Initiative kicking off for your benefit. What's the focus? I'm glad you asked this. Nutrition, fitness, and cancer awareness.
Duke is what we like to consider a lifeline here. They are responsible for providing information that helps us equip and empower our congregation, and the information that they have provided has been responsible for saving lives. And so we know that if we can continue to foster this relationship, it will only provide a greater opportunity for us to extend information and resources to our congregation and our community. If we can just keep a mom alive, a dad alive, then we've done our part. And with Duke, we hope to continue to have impact and continue to save families and continue to make a difference in the people that we're called to save.
That poster has pros and cons. Lincoln really couldn't operate effectively without the support that we get from Duke, and we like to think that we help Duke out in a very substantial way as well. In conjunction with them, we've been putting together a health fair. We call it the Men's Health Initiative for several years now. Originally, it was a prostate cancer screening kind of activity, but over the years, we've expanded that so that it now includes screening for high blood pressure, for diabetes, for HIV, for hepatitis C, for obesity. Thanks to the partnership that works well, it's well organized, it's efficient, and we get a lot of people through in a relatively short period of time, providing a lot of health information and hopefully some motivation and some empowerment for people to take better care of themselves.
If anyone needs any help in completing the paperwork, you can stay seated. We'll bring them out to you. You can relax. It's really interesting because when we think about the challenges that really prohibit people from getting access to care, it's not just the issue of the system, but it's also a challenge in terms of people having fear and concerns about trying to navigate this complex health system that sometimes even when I try to navigate a healthcare system, it can be quite challenging and almost a scary experience. So I think it's really important for this office and the work that we're doing is to eliminate those fears, break some of the myths that's out there around clinical trials, really being informants that help people make informed decisions. And not just having community events, not just making sure that we're getting information out to the community, but that we're really making an intentional and deliberate effort to partner with our community in an equitable way to address health disparities, to move the needle, and that means education, outreach, screening, treatment, survivorship, and participation in research and clinical trials.